Hi everyone! Welcome to the video on interacting with children with various needs in the healthcare setting. I will first touch on why the healthcare setting is stressful for a child and discuss the effect of temperament on behavior. We will also discuss some strategies to facilitate our interactions with an anxious child. Before we go into the specifics of how to interact with a child, we need to understand the following. What is this child's developmental age? Does this child have any special developmental needs? Does this child have any social-emotional factors that may affect the interaction with you? Does this child have any previous healthcare experiences, especially negative ones? A visit to the doctor or dentist can be a stressful experience for a child. As medical professionals, we hope to make the experience as pleasant as possible, as these procedures can affect the child negatively. In the short term, those with greater anxiety before surgery are at risk for increased pain and poorer cooperation with medical staff. In the long run, the child's emotional and behavioral development can also be affected, and their negative experience can impact on their future experiences. Putting ourselves into the shoes of the child will help us understand why the experience is so daunting. The child may feel like he or she has lost control. There is a disruption to the rhythm of everyday life, separation from the familiar environment of home or school, missed social interactions with siblings and schoolmates. There are many new experiences to grapple with. This may be especially challenging to someone who prefers sameness and routines. For example, a child with autism spectrum disorder. A child with anxiety may also feel especially anxious in the new environment or with new experiences. Limited understanding of what is happening may also cause misperceptions of the medical experience. The child may feel guilt or shame as they perceive the procedure or illness to be a punishment for their disobedience. This may be cultural as well, as it is not uncommon in the Asian culture that parents threaten their child that they will get an injection should they misbehave. In some instances, the parent's help may be enlisted to restrain the child during the procedure. This can further reinforce to the child that they are being punished. The child may also feel betrayed by the parent. Children are more perceptive of their parents' emotions than we give them credit for. They may also be more affected by their parents' emotions than we are aware of. As such, parental anxiety and the parent's own experiences may also shape the child's feelings surrounding the experience. It is important to be aware that the experience of every child is different, hence, an individualized approach for each child is imperative. Contributory factors include the child's temperament, past experiences, developmental age, developmental needs, cognitive ability, as well as parent or caregiver factors. I will be going through some specific scenarios in which interactions with a child in the healthcare setting may be particularly challenging. Whilst the diagnostic criteria for some of the conditions I will describe is beyond the scope of this presentation, I will aim to provide you with some background information to help you understand why these children face more difficulties and how to tailor our approach accordingly. In this video, we will focus on the effect of temperament and behavior and interacting with an anxious child. What is temperament? Temperament refers to the behavioral style of the individual, the characteristic pattern of experiencing and reacting to the external and internal environment. It is beyond the scope of this presentation to go into deep detail for the temperaments. What we will cover is how one would need to adjust one's approach for the various temperament types. A misfit between the child's temperament and the values and expectations of the person interacting with the child can result in friction during the interaction. Before we go into that, let's take a look at the various temperament dimensions. Chess and Thomas in 1956 described the various temperament dimensions as follows. Firstly, activity. Activity refers to the amount of physical motion the individual has during daily life. For example, during sleep, eating, playing, dressing, bathing. Secondly, rhythmicity is how regular the physiologic functions are. For example, hunger, sleep, elimination. Thirdly, approach or withdrawal, nature of initial responses to new stimuli. For example, people, situations, places, food, toys, procedures. Fourthly, adaptability. Fifth, intensity, regardless of quality and direction of response. Sixth, mood, overt behavior rather than assumed internal feelings, that is friendly and pleasant versus unfriendly and unpleasant. 7. Persistence or attention span. 8. Distractibility. 9. Sensory threshold, the amount of stimulation, for example sound or light, needed to evoke discernible responses in the child. The basis of the strategies we will be discussing is based on working with the temperament rather than against it. We will discuss about the challenging child and slow to warm child, and then go into the various temperament dimensions and what strategies will facilitate the encounter. The challenging child is one with low adaptability, low initial approach, largely negative mood, high intensity, and irregular biologic functions. Speak with the child's caregivers to find out what may trigger the child to get upset and try to avoid such triggers. Also, be sensitive to the child's cues. Back off when the child is starting to get upset. This child will do well with predictability, hence adequate preparation of the child with what to expect will help. Visual cues to remind the child during the encounter would also be helpful. As the child may have high energy levels, frequent movement breaks will allow the child to channel the energy appropriately. Frequent specific praise whenever the child does something positive will encourage the child to continue his or her positive behaviors. The slow to warm temperament is similar to the challenging temperament, but is less intense and less active. What will help will be clear instructions to the child with minimal transitions. Frequent positive feedback will encourage the child. The child should be given ample warm-up time for new activities. Exercise extra patience when engaging with the child. The child may require additional time to finish tasks. Here are more strategies for some temperament dimensions that may be more challenging. Moving on to interacting with an anxious child in the healthcare setting. The healthcare encounter can be even more stressful for a child with anxiety. Let's discuss some strategies that may help the child feel better. First and foremost, stay calm. Pay attention to your own feelings. If you are starting to feel anxious, try to calm yourself down before re-engaging with the child. The fear of the unknown can be circumvented by adequately preparing the child beforehand. Let the child know what to expect and try not to give too many surprises. Set clear expectations and give extra notice and time before upcoming transitions. Slow down in terms of how we speak, how we move, etc. The child may require pauses or breaks during the encounter. Allow the child to signal to you when a break is needed. Leaving the break unstructured may give rise to more time for rumination. Cognitive distractions such as a Lego or puzzle for the child during the break may be helpful. Empathize with the child. Give frequent and specific praise of the child's efforts to encourage him or her. If possible, give the child some choices so that he or she feels a sense of control. This can include where to sit, when to have the procedure, etc. Engage the child's caregiver. Allow him or her to be present if this can help the child feel less anxious. Find out from the caregiver what calms the child down, what triggers more anxiety. A calm and compliant sibling may be a good role model for the child. Discuss beforehand with the caregiver if this is likely to help or make things worse. If the child has a comfort object, he or she should be allowed to bring this along. If the child has been taught self-calming techniques by his or her therapist, he or she should be encouraged to use them. Be vigilant and responsive to the child's cues. Be flexible, as the encounter may need to be modified or shortened. Before we end the video, let's recap. The healthcare setting can be stressful for children. The child's temperament affects how the child behaves and responds. We have discussed some strategies to facilitate the interaction. We have also discussed some strategies to mitigate the child's anxiety.